Good morning. My name is Tim Tholen. I am the President and CEO of Thoughtful Care, based in Prairie Village, Kansas. Today we're joined by the Chief of the Prairie Village, Kansas Police Department, Chief Tim Schwartzkopf, and Dr. James Birch Jr., Associate Professor of Family Medicine at the University of Kansas School of Medicine. And today's topic is going to be about preventing wandering and promoting safety. Gentlemen, would you please take a moment to introduce yourselves a little bit further?
Thanks, Tim. Good morning. Again, my name is Tim Schwartzkopf. I'm the police chief in Prairie Village, and certainly this topic is important to law enforcement because a lot of times the first people that get contacted is us. So happy to be here and hope to share some good ideas with you.
Perfect. Thank you. Dr. Birch?
Yes, good morning, Tim. I am affiliated with the University of Kansas Health System, and I spend most of my clinical time providing primary care and consultation services for the geriatric population, older adults greater than 65 years of age.
Big population.
Yes.
Good. Well, again, today's topic is going to be about primarily prevention and addressing safety in both the home and outside of the home, as well as discussing wandering and what that means to our population of senior adults and some ways we can go about working with that and addressing it. So this is going to be a panel discussion, and feel free to chime in at any time that you have something to add to the conversation, and there should be some good information for our viewers. So again, there's two issues that primarily affect people with dementia, which is the primary issue we're talking about, and that is safety both in the home and outside of the home, and again, wandering. And it's important to note that as we all see the issues, as the disease progresses, the severity of the issues become greater, and more involvement from both the law enforcement side and the medical side, as well as the professional side, is something that we would like to get the information out to our viewers. So I think it's safe to say that we want to prevent before it actually happens and there's an emergency, whether that be, certainly a police emergency or a medical emergency, and that's kind of the focus of the talk today. So first, I think it's good to talk about safety in the home, and I know from my experience, we recommend certain items that can be addressed in terms of what we see, and we can advise on how to outfit the home, but maybe you all have some helpful suggestions that you have seen both that prevent falls in the medical side and certainly the life-saving side.
Sure. Well, fall prevention is certainly an important topic. Falls is considered a geriatric syndrome, and sometimes older adults fall and don't sustain injury, and there are times when falls occur and serious injury occurs, such as a hip fracture. Older adults 80 years of age or older who sustain a hip fracture have a 25% mortality within the first year
Wow.
of the incident. So it is very important to modify the environment, particularly the home environment, to reduce the risk of falls occurring. One of the ways, well, first of all, let me say there are a lot of fall risks in the home, but one of the ways to prevent falls is by removing loose carpeting from the floors, carpeting that, kind of bunches or, bends in the middle, carpets with raised edges, and any uneven surfaces in the home. It's a good idea to remove them. Another one that's often taken for granted is the importance of maintaining good lighting in the home. And it doesn't have to be bright lighting. For example, I have a patient who got up in the middle of the night, and of course the bedroom is completely dark, and she had been shopping earlier that day and left a shopping bag in the middle of the floor and didn't see it and tripped over and fell. But had she had even a dim night light in the bedroom, that fall may have been prevented. Other things would include minimizing clutter. When children are in the home. Of course, toys can get scattered everywhere, but even if there are not children in the home, maintaining clear pathways in the home by minimizing clutter is important. Pets can also be a problem, certainly, being mindful of where a pet is would also help to reduce that risk.
Okay. And from the first responder perspective, what are some things that you're seeing or your people that you work with are seeing when they get these first calls in approaching some of these homes?
Well, Dr. Birch summed it up pretty succinctly as far as some prevention, certainly. But I think, again, when our officers show up on these type of calls, they are certainly looking for the same things that he mentioned. I do know that they are, if they find something that is a walkway that isn't clear, they're trying to help out as much as they can.
Right.
There, just on scene. Something else certainly is having grab bars installed, maybe in hallways or in areas that the person frequents. But all in all, you summed it up very well as far as a lot of the prevention.
In our side, what we notice when we walk into homes is hygiene, and that we look at that as a clear indicator that maybe there's a fear factor now of certain parts of the house, particularly the shower. Do you have any input for families to look out for when it comes to hygiene from the medical side?
Well, as dementia progresses, bathing is usually the first activity of daily living that patients with dementia stop. And of course, it's generally pretty obvious when patients are not bathing or changing clothes, and when we see them in the clinic, we do bring that to the attention of the patient as well as to the caregivers or to the family members
Right.
living in the home, and express our concern that it appears that some assistance is going to be needed.
Right. Maybe moving further down the line from hygiene is some discussion about dehydration and malnutrition can be additives to safety issues in the home. If you're malnourished or if you're dehydrated, you might be lightheaded standing up and you would have a fall.
That is correct. And that's a greater concern usually for older adults who live alone.
Right.
And for any one of a number of reasons, lack of support system, inability to utilize transportation. These individuals may not have access to the grocery store and may not be able to even prepare a meal if food was brought into the house because they have forgotten how to do those things. Malnutrition and dehydration are very common in the older adult. And when we see evidence of that for an individual living alone, it's usually time for an intervention.
Right.
And anytime malnutrition is present, along with any one of a number of other comorbid illnesses, it complicates those other illnesses and also adds to the risk of morbidity and mortality.
And I would imagine that by the time they come into your clinic, they have already been malnourished or dehydrated. And again, this is a talk about prevention. So are there some tips you could offer some of the viewers on recognizing the initial signs of that malnutrition issue?
Generally, we look at a patient's weight, and if a patient has lost 5% of their weight within a month or more than 10% over a 6-month interval, those are red flags that malnutrition is likely occurring, and we can further verify that with various blood tests that we can do. But it is a very serious and concerning problem in older adults. I might also throw in that as some adults grow older, and we're talking about octogenarians, late 80s and 90s, there's a phenomenon called the anorexia of aging, and that is a situation where the signals between the stomach and the brain don't work well, so that an older adult patient really doesn't feel hungry.
Right. So when we're, from our side, looking and talking to families and offering them suggestions and advice, we're always telling them, don't be that family that waits 6 months too long before they call for help, and there's the immediate help if there's a fall and they call the first responders, and then there's the secondary need for professional help, which is, the medical part of it. Mm-hmm. And then there's the third level, which is outside help or moving into a facility. So maybe could you both give some options or some insight into when you see, from your perspective, when it's time to call for a professional, whatever that might be defined as?
Do you want to go first?
Sure. Tim, like we were talking earlier, I think as these difficult conversations for adult children to have with their parents, unfortunately, sometimes happens after the fall or after it's after the fact. So, I would just suggest that when you start seeing those signs of just the little things, and start paying attention and start having those conversations earlier. I know they're difficult, but certainly keeping the safety of their parents in mind, if they put that at the forefront, and kind of couch the conversation with safety in mind of not only themselves but others.
Right.
I think that's a good starting spot.
Yeah.
And even in communicating with an older adult about changes that are being recommended, continuously emphasizing I love you and I'm concerned about your safety is really tantamount to proceeding with any change. Geriatricians will evaluate a patient's functional capacity to assist in making decisions about when it's appropriate for an intervention and what that intervention should be. We look at basic activities of daily living and instrumental activities of daily living. A lot of people wonder what the difference is between, for example, a nursing home and an assisted living facility. And it all centers around the patient's functional capacity.
Right.
Patients who stay in assisted living generally need help with instrumental activities of daily living, and when they can no longer take care of their basic activities of daily living, then that's when the transition might occur to another form of long-term care, commonly referred to as the nursing home.
Right.
So those are our parameters for determining when intervention is appropriate. Many patients continue to live independently and get assistance with instrumental activities of daily living. And we certainly are not trying to push everybody into nursing homes. We want to assist everyone with maintaining independence as long as possible.
And I imagine both of you, when you're getting called or when you're addressing somebody that's in that older age and there's a distinct possibility of dementia, you're probably dealing with their caregivers as much as anything else, and you might be seeing some of the stresses and unwillingness to accept reality on them as well. And that can be a challenging conversation to have with them. Is here's where you are with your mom, dad, whatever it might be.
Right.
And they might say, oh, it's fine, he's fallen before, or, oh, mom's just, she's always been a picky eater. You get those coping mechanisms, and having to get through to them that, no, this is what's really happening can be certainly a tough sell.
Yes, it really can. And denial on the side of a caregiver is very, very difficult.
Yeah. The big river to cross is the joke.
Yeah, and unfortunately, some family members have to experience a crisis with their loved one before the reality really
Right.
hits them, and we are seeing patients actually progress in that direction and are trying to do everything we can to assist caregivers
Right.
in moving in the right direction, be it in the home or moving to another form of long-term care.
Yeah, it's hard for us too, because that's who we're primarily dealing with, and they just don't want to accept it. You know, mom only needs an hour a day. Well, there's 24 hours in a day. So what can happen in the other 23 hours that you're not there and nobody else is there? So maybe that's a good segue into wandering. You know, wandering is a big issue when it comes to the elderly, especially with dementia. And there's a variety of ways people can wander. You know, they can wander in their car, they can wander out the front door. What are the triggers? What are the warning signs? And so I think that's where we could probably start moving into that. So maybe a definition of wandering is helpful. You know, wandering is when somebody leaves where they are and goes where they think they're going to go, but they don't quite know where they're going, and that's a real loose definition, I understand. But it's a big hazard, you know, especially with the elderly people and certainly mobility now. We're moving into the winter months, and so wandering by walking out the front door, we've got hypothermia issues and certainly motor vehicles. That's the big one, the big loss of independence. So, you know, there's some statistics out there from the Alzheimer's Association that they estimate that between 6 to 10 people will be affected by a wandering experience. And so maybe give some anecdotes of some wanderings that you have seen.
Yeah, certainly that is not an uncommon call for law enforcement. I'm sure every agency across the country deals with this on a consistent basis, and certainly in Prairie Village we have had these calls of, and usually it's a passerby saying somebody is walking down the street. It's 30 degrees outside, they don't have a coat on, and then we obviously show up and do what we can to help them. And again, I think these are, at least on the law enforcement side, if we can, ID is one of the important things for us, and that can be very challenging if somebody doesn't have, we don't know who they are,
Right.
Where do we start? But we'll certainly get them safe, and then we'll work from there. But it is not uncommon for, as we were speaking earlier, for people to park their car at a shopping center, and then they call us saying their car's been stolen, when
Right.
in fact it's just on the other side of the parking lot and they don't remember where they parked.
Right, right. Now, are there some warning signs? I mean, you're getting it after it's already happened. Mm-hmm. You might have some input on looking out for when it might happen from the medical side.
Right.
Expand on that.
So there are a lot of early warning signs. I often tell students that not everyone owns a car, so that you know, getting lost doesn't always involve operating a motor vehicle,
Right.
but patients who even use public transportation and forget how much that it costs, or you know, forget where to get on the bus and where to get off, are at equal risk of wandering and getting lost as anyone who drives a motor vehicle. But we have had some patients who have forgotten literally how to get to our clinic
Right.
at the Landon Center on Aging, and that is a very early clue that patient should probably not be driving, and we will communicate that to family members. But even if an older adult is in a house and they forget where the bathroom is, or forget which closet that their clothes are located in, those are some very early clues.
Right.
That they are at risk for wandering. And the biggest patients, or let's say the greatest risk for wandering, is among those patients who have dementia and are ambulatory, mm-hmm. meaning that they are capable of walking.
Right.
You know, they get real restless. If someone has been retired for 30 years and they're starting to get up at 4 o'clock in the morning to get ready for work, that is a clue also
Right.
that they are at risk for wandering.
And one of the things that we see, or one of the things we ask people when we start care is, is there hallucinations happening? Because that's a part of dementia. It can become a part of dementia. And they
It
start saying,
can.
oh, there's my mom. And, oh, I want to go home to my house, because their brains are not in 2018, they are in the past.
Right.
And that's one of the things we ask families is, are they talking to people that have not been here for a while? Or are they trying to go home? Or are they afraid of being alone? That's the other one where you see it, where there's
Sure.
two spouses in the house and one spouse who's the caregiver and is going from room to room doing things, and the other one is following behind because their fear of being alone.
Yes. Yes.
That's from what we see the most, which is
Sure.
it's a challenge.
It is.
We all want to go home, and even if you are home.
Yes.
So one of the things that we also see is that, as I just kind of tied into, is that extreme reliance on the family caregiver, because by the time we get there, there's obviously been a history of care being provided. And what does that do to the caregiver as well? And so caregivers sometimes, I think, can miss those signs, or it's kind of the lobster in the boiling pot. They don't quite
True.
understand that the temperature's coming up because they see it every day. Maybe some signs of caregivers or some advice to caregivers on what to
Sure.
look for.
One thing to keep in mind is that dementia doesn't affect every individual the same way.
Right.
It often depends on what part of the brain is involved with the dementing process. So signs and symptoms may vary from individual to individual, but caregiver stress does come eventually, and I think that the stress is very high for caregivers who take care of individuals who have had problems with wandering, and also when a patient needs more assistance with those basic activities of daily living. We're talking about bathing, dressing, continence, feeding, toileting, and transfers, taking care of those basic activities of daily living involves a lot more physical engagement.
Right.
With the patient care, and certainly adds to the stress and the exhaustion. And it's very important to touch bases with the caregivers when they bring their loved ones into the clinic. We have at the Landon Center on Aging at KU a caregiver support group that is specifically for those caregivers who are taking care of loved ones with dementia. And that support group meets once a month. And there are family members who have had that experience who provide support for individuals who are now caregivers for a loved one
Yeah.
with dementia. Does that answer your question?
Yeah, it does. And I was going to take it even a little bit step further from our perspective inside the home. What we're looking for, or advising rather families to do, is we keep a behavior log, because typically if there's a wandering incident, it's going to become a pattern, is what we've seen.
Yes.
And so we encourage families to keep a log of behaviors throughout the day and times, and what might have been the trigger, because there might be a trigger for that wandering.
Sure.
At 5 o'clock, it's getting dark. They remembered it was time to be home,
right.
and that was just the way they grew up. And so at 5 o'clock, if that behavior log shows that there's wanting to go out the door, now you need to start addressing the home and how do you prevent the wandering. Whether we
Exactly.
add alarms to the house, or
Yeah.
I've even seen families remove doorknobs, or move the doorknobs and
Yes.
up high so
Yeah.
they can't see them, things of that
Yes.
nature. So
Yeah.
that's the one thing that we really encourage people to do, is keep that behavior log, because it'll tell you after a period of time some things to look out for.
Another thing I might add is that a lot of family members have an expectation that a physician will provide medication to sedate their loved one at night,
Right.
to reduce the risk of getting up and wandering. But we don't like sedating our older adult patients because those medications can affect older adults in ways that can actually cause more harm. Examples of that would include making confusion worse, increasing the risk of falls, and delirium. There are several other adverse effects that can occur. So we really try to avoid the sedation option because it's not a healthy choice for the older adult patient or the patient at risk for wandering.
Right. Now, we're looking at, when we've talked about preventing or recognizing, now we need to talk about it's already happened. And this might be more for Chief Schwartzkopf's input here, but from the from the police perspective and the first responders perspective, are there programs out there that families need to be aware of, that they need to involve and enroll their parents or certainly loved ones in?
Right. Yeah, absolutely. So in Johnson County, the Sheriff's Office has the Take Me Home program, and the caregiver can sign up their loved one through the website or get a hold of the Sheriff's Office and can sign them up. And then if the loved one is found wandering or somewhere else, at least there's a database with that info and contact information. And then I think it's also important that to get a hold of your local police department and let them know of situations going on in the home, and give us your name and phone number, so when we do go to your parents' house, we have somebody to call immediately versus trying to figure out what we need to do.
Right.
So certainly those resources are there. Again, I think it's being proactive. It's as it starts to happen, call us, give us your name, give us your info. So again, we're not behind the eight ball, so to speak, when the crisis is happening. We have somebody to call.
Right. Have you seen or heard from families about some ways they have disabled the car or removed the car, or any of those tricks that are out there?
Yeah, there's taking the keys is an interesting conversation for the family, but I think it's while it's difficult, it's to something that he was saying earlier. If these things happen, you need to eliminate this from the equation and take the keys. Don't be afraid to do it, because if again you're concerned about your loved one's safety. That's what this is about, or them hurting somebody else driving on the roads. I'm not saying it's easy, but it is certainly, you can certainly call local law enforcement. We can walk you through it before it happens, but I think it's when you get right down to the brass tacks, you just take the keys. And
one of the questions that we get is from the adult children primarily, that they don't want that conversation to happen. They don't have the ability or the desire to stand up to their mom or their dad or whatever, and they ask me, who could I talk to take away their keys and their driver's license? And we recommend a doctor or an attorney, a trusted advisor, but they also ask, will the DMV or will the police do that?
So we get that question a lot about retesting. Can we send my parent in for a retest? And we just can't do it arbitrarily. I'm not sure on the medical side if they can. They may be able to, but on the law enforcement side, there has to be an event. So there has to be an accident or some type of contact where we have seen driving behavior that is concerning. Then we can send them in for a retest. And that's certainly an option, but again, I think communication is key. So pick up the phone, come into the station, start just asking questions, get the ball rolling so you understand how it all works and what to do.
Right.
Very recently, the family members of one of my patients took the keys away, and the gentleman with dementia actually hotwired the car and was able to get it started. And this is a man with significant cognitive deficits, but it also highlights how how dementia is. You can communicate verbally with a person, and 5 minutes later they can't remember what you said, but they can remember something from 20 or 30 years ago with very exquisite detail.
Yeah.
But that is the nature of dementia. And I have known some family members to just remove the battery from the car so that they are not able to get it started. And it is a very difficult conversation, and I have had to be the bad guy for a lot of patients and tell them you just cannot drive, and we don't recommend it. What we can do when we have concerns, though, is that we can report individuals for whom we have concerns to the DMV in both Kansas and Missouri, and we also have a driver safety program, and there is driver safety research ongoing at KU. We can refer patients to occupational therapists that actually focus on driver safety using a driver simulator. And if a patient is deemed unsafe, then that information does get reported to the DMV.
Okay, so that's interesting. So the medical community is addressing it somewhat legally by saying we'll take the testing, ahead of the DMV, and if we from the medical community see an issue, then we can alert the family to alert the DMV, and we can alert the DMV. So, okay, that's interesting. That's a good piece of information. One thing that people ask me is, okay, so mom, I'll just use mom, has wandered before, and we're still working through this process, but when she did wander out the front door, we had trouble finding her. And we touched briefly on an ID bracelet of some sort, and certainly nowadays technology has moved so much into our lives. I mean, these cell phones that we have are so phenomenal what they can do, but the person with dementia may not know what the cell phone can actually do.
Right.
Have any of you had any experience with using GPS tracking devices or geofence locators around the house or alarm systems?
I don't have any experience with GPS locators. I am aware that they are available and can be attached to motor vehicles. ID bracelets are also very helpful for identifying patients who wander away. And there is also a very chip, VERI, very chip information, very chip that can be inserted under the skin.
Okay.
I know it is being used in some of the larger metropolitan areas for patients who are at high risk, and the chip gets scanned and it provides the patient's demographic information as well as all of the medications that they are taking in the event that they are lost.
Right.
But again, I haven't had any personal experience with any of those technologies.
Yeah, I haven't either. I think that's pretty interesting. I'm going to go back and figure out how that works, right?
Yeah, that's interesting.
The scanner, because I know they have it for
pets.
it's for pets, but I don't know if it's the same type of database or same type of scanner. What to kind of figure that, but that's interesting. Yeah. I think at the end of the day is if we have good contact information, that is so very important. Because it gets let's just say it's mom. It gets mom back to where she needs to be sooner rather than later. We're going to take care of the situation, and we'll get her somewhere safe. But that's going to be a very scary situation for her. And so if we can have contact information, son, daughter, grandson, anybody that we can at least call immediately, that is so helpful to law enforcement.
And how does the Silver Alert program work? Can walk us through that process?
If that's a process that if your senior has disappeared, and a lot of times try to figure out circumstances behind it, and it may not get triggered right away, but it's certainly info that we can put out that stretches beyond the boundaries of Prairie Village, and very similar to an Amber Alert type situation. We don't kick those in right away, because a lot of times we can solve it pretty quick. We can figure out what happened. But at the end of the day, if you're, if the question is, who do I call? The easiest number to call is 911. It's an emergency. You're going to get law enforcement immediately. Just explain, my mom, she's been gone for the last 30 minutes. She is prone to wandering. She has dementia. And because we'll get our patrol officers out there, start looking for, we'll get some information to other agencies in the area, because Johnson County is has a lot of different police departments, and you can literally walk from Prairie Village to Fairway to Mission to Merriam all in about 30 minutes.
Right.
So it alerts everybody, but there are certainly programs out there that if things are triggered, that we can get information out to a lot of people very quickly to be on the lookout for your loved one.
Okay, well, that's good information. I've always wondered how that worked. One of the things that families ask us is there's an expense associated with having outside help in, and how do they delay that? And we always recommend, the technology side, the cameras. I mean, put cameras outside the house that are alerted when the door opens, and it'll alert your cell phone, and you can monitor. And I've seen the breadcrumb, on a Google map, where you can go to find them based on a tracking device. And so other issues other solutions, I suppose, is the way to put that. There's a tipping point that families come across where they've had too much. They can't take care of it anymore. It needs to be addressed professionally. The aging in place issue is the primary thing. And maybe, Dr. Birch, can you give some ideas to families that might be watching about when it's time to say, let's go investigate a long-term care facility?
Well, that's a real good question. I think the threshold varies from individual to individual. It's one thing to have a loved one who has dementia, but is quiet and calm and non-threatening, and doesn't want to go anywhere. You actually have to push them, to get up and walk and move around. Contrast it with a patient who has dementia and who's up all night in and out of closets and cupboards, and clanging and banging with the pots and pans, and trying to leave, or worse, one who is combative and doesn't want to do anything that they are encouraged to do, on top of needing to be bathed and cleaned and toileted. So there are all of these variations in terms of how dementia presents itself. And I would say that when a caregiver's health is at stake, be it physical health or psycho-emotional health, that when there's a decline in those areas, then that's when it's time to probably seek intervention of some type. But hopefully we can help the caregiver before they actually get to that point.
Right.
Hopefully.
When you're talking with families, there's the law enforcement side, because there might have been fender benders, or there might have been falls or slips or trips, and then there's the medical side, and then there's the what do we see when we're in the home, and families are looking to us for help, all of us. You're right, it changes for every family. And it's just, it depends on a variety of factors, financial and medical and legal and all encompassing. And it's a challenge for families. I definitely understand that.
Yeah, I forgot to mention the financial factors, which is probably one of the biggest influences on choices and decisions.
It is. In another video series we did, we talked about the financial tipping point, and it's loosely defined as the needs of care are now outweighing the ability to pay for that care. And when is managing that finance appropriate to say it's time for mom to go to the nursing home or long-term care facility or the memory care facility, whatever it might be, because they're going to do better there for themselves, but also to maintain the financial ability to pay for some of these aftermarket cares.
Exactly.
So that tipping point has many different definitions, but it's generally driven by money. That's
It
the challenging
is.
part, because
Yeah.
getting old and the elderly issues can be expensive.
I agree.
And it's a mixture of Medicare, Medicaid, private funds that families have to address. You know, and it's too bad we didn't have a financial planner on this panel. Maybe we could talk a little bit about that. But
Yeah.
so I guess the next topic is, how do you have the conversation? You know, how do you as an adult parent, or excuse me, an adult child, talk to your parents? You know, because there's so many different issues going on. There's their medical side, there's the driving side, there's the living alone side. I mean, if you've got any advice, you probably do it more than the police department does, but
Yes. One of the things that I think is very important is to have those conversations early, before any type of cognitive impairment occurs. You know, Dad, let's say you should start having memory problems and you can't take care of yourself. What would you like for us to do? And if you don't get the opportunity to have those conversations, I think having your loved one to be seen by a geriatrician to do an overall functional assessment, we can assess the patient's medical complexities as well as their ability to take care of themselves and provide recommendations on what we think the next best steps are to maintain that patient's health and safety.
and from the law enforcement side, are there organized or pre-planned plans of safety that can be put into place so that if the conversation becomes difficult, at least you've got some sort of organized document that helps primarily the law enforcement and the first responder side to deal with some of the issues that might come up because the conversation hasn't happened yet or is in process?
Not really. I mean, I think that's great advice. Start having the conversation, and some that we've even done on our own family is have a choice in what's going to happen to you down the road before
Right.
you don't have a choice. And I think that's very important.
A good point.
Yeah, I think it's, you know, at least on our side, is what we see is we're always seeing if you want to call it a crisis or something that happened after the fact. It's the accident or it's the fall, because we will go on those medical calls. And so if you can just echoing what Dr. Birch said, if you can start having those conversations early, and even though they're difficult, I think at the end of the day, it'll make it much better for everybody.
Right.
You know, get things in place. A lot of great ideas. But one thing that I'm just picking up here and listening to both of you is one size doesn't fit all. And so there may be something that works for this patient that doesn't work for this patient. Exactly. And sometimes it's a little trial and error, and you know, at least what I just picked up just listening in the last half an hour. But I think, you know, law enforcement's here to help.
Yeah.
So we are, and I tell our new officers this, when people don't know who to call, they call the police. And our job is to go and do what we can to help them. And that's either finding services, but helping family. So we're here to help as a first step, for sure. So I would just encourage, you know, viewers, if you're afraid that you think we have better things to do, that is not the case.
Right.
We're here to help. Please call if you need us.
Right. That's a good point.
I might add that the best way for anyone to make sure that their personal preferences are addressed in the event that severe memory loss or dementia becomes a problem is to have a document called Durable Power of Attorney signed. Once dementia sets in and decisional capacity is lost, you know, that individual can't sign a durable power of attorney. It becomes a lot more complicated, and families have to apply for legal guardianship.
Yeah, that's
but they
challenging.
don't have to take that step when the individual has decisional capacity, or, you know, has high functional capacity, that is the time to get those documents signed.
Yeah, write it down.
Yes,
That's what we tell families, write it down.
Exactly.
It's better to do that early than later.
Later,
You know, when the crisis happens, we tell people, don't call us when it's 6 months too late. You know, call us when you need the pre-planning. So to kind of close up, I think what we've talked about mostly is prevention, but be vigilant about that, because if you are vigilant and do the preventative side, then you can start to relax.
Yes.
The pre-planning, the addressing, the other issues that we've talked about today. So thank you both for being here, and we're going to open it up for some questions and answers, and they will be given to us here momentarily, and feel free to chime in, and we want to thank you gentlemen again. So,
Sure.
All right.
Thank you for inviting us.
My pleasure. Questions?
So I have a question here about medication management and the safety regarding that in the home, but also getting doctors lined up so that they're all in line, because people who have dementia don't always comply with their medication management. And I know that the opioid crisis affects elderly people too, because they take more than they need to take when they have them in the home. Can you point out some tips from the panel talk to that?
Well, medication management is one of those instrumental activities of daily living that I had mentioned earlier. And when patients are not taking medications properly, we can get early clues of that. For example, a patient who has high blood pressure that's normally controlled, and gradually over the past 6 months or 3 months or whatever, you notice that the blood pressure is getting out of control. So those are can be very early clues that that a patient could be developing dementia. And if at all possible, again, it depends on the situation, but particularly for patients who live alone, we will consult with a home health service and have a nurse to go to the home and assist the patients with the use of pill boxes, and certainly document all of the medications that are in the home, and oftentimes even educate family members on the proper administration and use of certain medications. In geriatric medicine, we frequently do medication reviews and try to identify medications that are not necessary. When patients are seeing different doctors in different hospitals and different institutions, it also makes the coordination of medication use a little bit more difficult. And that is always a challenge. Older adults also have a lot of chronic pain for multiple different reasons, and managing that pain is a quality of life issue. Right. So there are times that narcotic medications are necessary to manage chronic pain, but with the assistance of other healthcare professionals, we do what we can to make sure that the utilization of those medications is appropriate.
Good.
Okay, we've got another one about, this is for Chief Schwartzkopf, about registering elderly people with the department. Are they registering? Who do they call exactly to do that? Do we do that with the police? Do we do that with the sheriff's department? Can you talk about the programs that are available from the first responder point of view?
Right. The program with the Johnson County Sheriff, the Take Me Home program, you would register with the sheriff's office. So that information is on their website. But another step you could do is, again, so for instance, in Prairie Village, if you're a caregiver or an adult son or daughter, and you have these issues with your parent, you can call up to the police department, just ask to either speak with an officer or dispatch, and just give us your information. And again, it's just a contact. So if we go to the home or we come across your loved one, we'll have that in our database, and it'll give us at least an initial point of contact in that event.
And that database is accessible to everybody, even in their cars.
So yes, but generally our dispatcher would have the information. So he or she on duty would pull it up, the address or the name, and just have here's a contact. Just call notes in there.
Right.
Possible dementia patient, contact son. Here's his name and phone number.
Okay.
Yeah.
All right, I think we have time for one more question, and then we'll wrap it up.
Question about sundowning. Can someone talk about what that phenomenon is and how to prevent some of the issues that happen in the evening? Because that seems to be a theme for people with dementia.
Right.
Sundowning is another term that's used to basically describe delirium. And delirium is essentially a sudden onset of confusion. And the confusion takes place in many domains. It's called sundowning because it usually occurs at about the same time every day, usually around dusk. So a lot of older adults will become more confused, may not recognize where they are, may begin asking the same questions over and over, become restless, agitated, attempting to leave the home. Again, we do our best to try to manage these conditions without medication, but when, in the case of patients being at risk for harming themselves or harming others, medication intervention will sometimes be appropriate. But the best thing to do is to try to redirect persons who are experiencing sundowning and, try to reassure them that everything is okay.
Right. Okay, well, thank you very much, gentlemen, again, for being here with us today.
Sure.
And for getting the wrap. And it was, I think, a very informative session for everybody. So, again, thank you very much.